you know, with some children and young people, actually getting to a diagnosis. It's really important for us to really understand their epilepsy more, to maybe get to a diagnosis, a syndromic diagnosis, maybe, you know, identify a syndrome, because that then helps us, you know, in the treatment of the epilepsy. So a lot of emotions come up for children, young people and their families in that journey with epilepsy, really. The diagnosis of epilepsy in children, it has an impact on their development and on their emotions, just because they're in a very unknown world to them, and that very often, because children of that age, it's very difficult to them express their emotions. It may come out as bad behaviour or frustration or anger. So, you know, we need to be very aware of that when we're dealing with children. I think the other big group of patients that I see the impact of the diagnosis of epilepsy is around adolescents. I find that young people, when they are diagnosed with epilepsy, maybe at 13 or 14, it really has a big impact on them emotionally, just because they're just about to start, you know, going out and getting a bit more independent, and then they have their first seizure and then have this diagnosis of epilepsy, and the impact on them is enormous. You know, they are then living with parents who are very anxious about them, very anxious about them having another seizure, so maybe they can't do what they used to do, or there are restrictions put on them just to make sure they're safe. Again, we may not always get the right medication first time. Again, they may experience side effects of their medication, so that may impact on their behaviour, their personality. Again, it may come out that, you know, they might feel quite angry. What their peers can do quite easily and without, you know, thinking about anything, they can't. So, for example, going to sleepovers, you know, most young people go quite happily to friends' houses, play on the Xbox or computer games all night. They really do have to think very carefully about that, because sleep deprivation particularly may impact on their seizures. I think the other big thing that I talk to my young people about is around alcohol and how they manage the whole party situation, so that they don't appear different. So I do spend a lot of time talking about how they can manage that situation, because it's really important for them not to be different to their peers. But they do feel different. And very sadly, what I still hear from these young people is that there is still a stigma attached to having epilepsy, and there is still a lot of ignorance around epilepsy and seizures. And I do still hear that my young people have to put up with being bullied, being made fun of, and that's really hard, you know, when you're 13, 14, and facing all the stresses that normal teenagers face, and then you also have to deal with all the additional things that come with having a diagnosis of epilepsy. I think there does need to be a wider understanding of epilepsy, what it is, and the impact it has on these young people and their families. Also, I would encourage any young person who has got epilepsy to talk about their epilepsy. If initially they find it difficult, then talk about it to their epilepsy nurse specialist. Talk to someone who understands that it does have an emotional impact on them, Because by doing that, then the nurse may be able to identify either support groups that they can go to, or if additional help is needed, and maybe something like counselling is needed in order for them to really come to terms with their diagnosis, and even come to terms with how people are reacting to them, really, more so, then it's then accessing the right help.